All right, let's dive right in. Today, we're going to explore one of the most fascinating and critical connections in all of medicine, the link between our hormones and our mood. We're really going to dig into the neuroendocrine hypothesis of depression and see how the body's own chemical messengers can actually drive this incredibly complex disorder. So picture this. A patient walks into your clinic. They tell you they're feeling incredibly low, just exhausted all the time, and have completely lost their appetite. You know, it's a classic picture of major depression. But as a clinician, you have to ask yourself the big question. Is this all just happening in their head, a problem with brain chemistry? Or is there something deeper going on, a problem with their entire system? And here are those classic so-called neurovegetative symptoms we see. That persistent low mood, and of course, anhedonia, the inability to feel pleasure in things you used to enjoy. Then you've got the disturbed sleep, that profound fatigue, the changes in appetite, and a drop in libido. This is the reality for millions of people, and it's what we base our diagnosis on. Now, to really solve this puzzle, we have to look beyond just serotonin and other neurotransmitters. We need to zoom out and look at the body's master regulatory network. I'm talking about the endocrine system. Okay, so take a look at this. This is the fundamental chain of command. Think of the hypothalamus, right at the top, as the command center. It sends out signals to the pituitary gland, which then releases its own set of hormones. And those hormones travel to organs all over the body, like the adrenal glands or the thyroid, telling them what to do. This whole network, from brain to body, is what we call the hypothalamic pituitary end organ axis. And it is absolutely central to what we're talking about today. In fact, there's a whole field of study dedicated to this called Psychoneuroendocrinology. The source material we're looking at calls it a neuroendocrine window, and I love that description. It's our way of peering inside and seeing exactly how our hormones are directly influencing our minds and our moods. So, where do we start our investigation? Well, our first major clue comes from the body's #1 stress response system. And the literature makes a really bold claim about this next point. It calls it possibly the single most important discovery in the entire field of biological psychiatry. So you know it's going to be a big one. And here it is. It turns out that in a huge number of patients with major depression, their main stress axis, the hypothalamic pituitary adrenal axis, or HPA axis, is stuck in overdrive. It's chronically hyperactive. Their body is basically locked in a state of high alert, 24/7. So how does this actually happen? This is where the CRF hypothesis of depression comes in. It goes like this. Chronic stress, or maybe some genetic vulnerability, causes the hypothalamus to pump out way too much corticotropin-releasing factor, or CRF. This flood of CRF overstimulates the whole HPA axis, which leads to chronically high levels of the stress hormone, cortisol. And here's the kicker. Both that excess CRF in the brain and the high cortisol in the body directly cause those core symptoms of depression we talked about, the sleep problems, the anxiety, the loss of appetite. And listen, this isn't just a theory. We've got objective biological proof. When we do an MRI on these patients, we can actually see that their pituitary and adrenal glands are enlarged, basically from being overworked. We can measure high levels of CRF in their spinal fluid. We can detect way too much cortisol in their blood or urine. The whole system is clearly out of whack. But the HPA axis isn't the only endocrine system involved here. Our second huge finding connects mood to another key player that regulates our body's metabolism, the thyroid gland. Now, everyone knows that full-blown hypothyroidism causes depression. That's old news. What's fascinating, though, is how common subtle thyroid problems are in depressed patients. Take a look at this chart. In what we call grade 3 hypothyroidism, the standard thyroid tests, your TSH and hormone levels, they look totally normal. But if you do a stimulation test, you see this exaggerated response. It tells you the pituitary is working way too hard just to keep things balanced. The system is under strain, and that strain can absolutely show up as depression. So the huge clinical takeaway here is this. Yeah, we've known for 100 years that a low thyroid causes depression. But what we now know is that even these very subtle subclinical forms of thyroid dysfunction are incredibly common in these patients, and we absolutely have to be looking for them.
And this has huge implications for treatment. I mean, think about it. For a patient who isn't getting better with standard antidepressants, adding a little thyroid hormone can be a complete game changer. It can make the antidepressant work faster, or in some cases, it can turn someone who wasn't responding at all into a responder. It's all about helping to fix that underlying hormonal imbalance.
Okay, so let's put the pieces together. We have an overactive stress axis. We have a struggling thyroid axis. When you combine these clues, a whole new way of looking at depression emerges. It's not just a brain disease, it's a systemic disease. It affects the entire body.
And the problems don't even stop there. The research shows blunted responses in the growth hormone axis. We see changes in the prolactin axis and in the gonadal axis, which helps explain symptoms like low libido. It's like the entire endocrine orchestra is playing out of tune.
And this right here is why this is so critically important. This isn't just about feeling sad. This widespread hormonal chaos has real, serious medical consequences. Patients with chronic depression have a higher risk of heart disease and stroke. They have lower bone density. They have higher levels of inflammation throughout their body. The suffering in the mind literally gets written onto the body.
So let's go all the way back to our patient from the beginning. Their mental anguish and all those physical symptoms, they're not separate problems. They are two sides of the very same coin. And that coin is a profound systemic disruption of their entire endocrine system. The problem isn't just in their mind. It's in their body's master control system.
And this leaves us with a really powerful, forward-looking question. If we finally accept that depression is a disease of the whole system, then maybe the future of treating it isn't just about targeting brain chemicals. Maybe it's about developing brand new therapies that rebalance and restore harmony to the entire mind-body system.